China has gone through a lot in the past months and has finally stemmed the spread. Along the way, considerable experience has been accumulated. Let me mention the following. First, we have put people's lives front and center. We have adopted a people-centered approach. We spared no efforts and no resources in saving lives without worrying too much about economic cost. If lives are lost, what's the point of money? We have always taken saving lives our utmost priority. In Wuhan, for instance, more than 10 COVID-19 patients over 100 years old were cured. Second, as a nation, we looked out for each other. Nationwide, more than 40,000 health workers were rallied and sent to support the battle against COVID-19 in Wuhan, which was hit the hardest. From my home province, Jiangsu alone, over 2,800 medical workers went to Wuhan and Hubei to join the fight. Let me share with you a touching story. There is a young nurse who works in Wuhan. Her name is Gan Ruyi. During the Chinese New Year holiday, she was in her hometown 300 kilometers away from Wuhan. When she saw the news about the lack of health workers in Wuhan due to the lockdown, this young lady in her 20s did not hesitate a minute to travel 300 kilometers back to Wuhan. Since there was no public transportation, she biked and walked for 4 days and 3 nights. She just wanted to play her part in this fight. This story is deeply touching for me. Third, we actively engaged in international cooperation. Receiving help from other countries, we have also managed to help others. China has provided to the world an astronomical number of protective equipment, including over 20 billion masks and billions of protective suits and protective goggles. We also gained much experience in the fight against COVID-19. We adopted proven practices such as early detection, early reporting, early quarantine, and early treatment. We pulled together the best medical and technological resources and health professionals to improve treatment. We combined traditional Chinese medicine with Western medicine in therapeutics. We mobilized nationwide joint containment and control efforts. These measures have proved effective and enabled us to control the situation, save lives, achieve a cure rate of 93.5%, and now restore economic activities. Mankind has emerged stronger from the battles against this scourge of diseases, from smallpox to the Black Death to Ebola to H1N1 flu. Each of these diseases has left mankind with valuable experiences.